The weather is certainly warming up, which means it's time to show off these legs. And joining us now to help us make sure that those legs look absolutely fabulous, absolutely their best, we have Dr. Doug Gessner. He's a vascular and interventional specialist at Coastal Vein Vascular Institute, and Crystal Boatwright, who is a physician's assistant. Thank you so much for being here this morning.
Thank you for being here.
Oh, and we love being here, actually. This is absolutely gorgeous. You feel like you're walking into a spa when you come in here.
That was the goal.
Well, let's talk about first, what has been the biggest need that you've been seeing kind of walk through the door with these legs that need your assistance here at Coastal Vein?
You know, we've been open for almost a year now, and it's really been an absolute pleasure because we've had the opportunity to see patients that have had some treatments in the past for their venous disease, but really what they did is they were being treated for the kind of superficial stuff that was addressing things that were causing maybe some symptoms of swelling or issues, but the true underlying cause was the patient had a DVT in the past that caused an obstruction of the vein more centrally.
And a DVT?
It means deep vein thrombosis. That means someone, basically the blood that was flowing through the veins slowed down enough that it actually clotted and it blocked the flow of that vein. So just like plumbing in the house, when you have a pipe that's blocked downstream, it causes things to back up. And in the venous system, when you can't get the blood through the vein because of a blockage or a DVT, that causes the lower leg to swell. And so patients usually present to the emergency room with that. They come in with pain and swelling and redness. The treatment typically these days is they'll put them on an anticoagulation, and everybody these days knows someone who's had a DVT in the past. And so when they go home with the blood thinners, that helps prevent further blood clots from forming, but it doesn't get rid of the blood clot itself. So we're able to actually see those patients here at this clinic and offer them alternatives to help remove that blood clot and get them back to the quality of life that they're looking forward to.
So it's not just aesthetics. We want our legs to look good. We want our legs to be healthy. We want our whole system to be healthy.
Exactly.
And like, Crystal, let's start. You're new to Jacksonville. Welcome, welcome.
Thank you.
But you're certainly not new to this world. So let's talk a little bit about some of the specialties that you bring to the table.
Well, my passion is venous disease. I love treating patients and making a positive impact in their life. And usually patients present and they're not aware that the symptoms that they're complaining of is actually what's causing their discomfort, and it's due to venous disease. So when I was talking to Dr. Gessner about his vision for Coastal Vein, it became clear that we share the same mission: to provide superb clinical results while treating patients who otherwise are overlooked. Those patients who've had blood clots, who have ulcers, debilitating symptoms, who've been told, "I'm sorry, there's no treatment available." We're able to provide treatment and get them back to a healthy lifestyle, because at Coastal Vein we have two highly trained interventional radiologists who, with advanced imaging, can not only diagnose disease, but actually treat the full spectrum of venous disease and vascular disease. So what brings me to Jacksonville is Dr. Gessner, that we share the same mission to provide wonderful care for our patients, and I'm happy to be here.
And this was so informative. I mean, on one hand, you're thinking, oh, you just want it to look good, but then you're talking about problems that you're in and out of the emergency room for, and you can come and treat things and other types of ailments of the leg. So can you talk about how folks can come and maybe have an opportunity? Do they need to make an appointment to find this? Do you do some types of seminars or educational opportunities where folks can learn more about the services that you offer, and also maybe some of the conditions that they may be facing?
Well, our mission is not to only treat patients, but to educate the community. So you'll find us at health fairs throughout the community. We'll be at Girls' Day Out, Celebration of Nurses, Senior Expo in May and November, Sweetwater Community Health Fair, plus Coastal Vein will actually be hosting educational seminars throughout the year. So we really like to educate our patients, because an educated patient is a healthy patient.
And Dr. Gessner, real quick, can you tell us what if I'm not seeing it, or maybe I'm seeing a little something, but that it might be a sign of something bigger or more important or more dangerous, really?
Right.
What should I be looking for to be able to pick up the phone and give you a call?
Well, some of the signs you're looking for is swelling of the lower legs. You notice at the end of the day, you take your socks off and you can still see your sock line. Seeing varicosity. Sometimes people talk about spider veins and think of that more as a cosmetic issue, but sometimes that can be a result of something going on deeper. Varicosities, bulging ones, you see those sometimes in patients. You're at the store, you'll see some of the bulging veins. Those are more the signs. The symptoms really is pain. Again, that's typically relieved by sleeping, or when you lay flat at night. When you wake up in the morning, those symptoms are resolved. But at the end of the day, after a full day of walking, standing, your legs are aching, so you want to put your legs up at night. That's a typical type of symptom that patients will come with. But aching, swelling, heaviness, tenderness, bruising, areas in the legs, those are the type of things that you're looking for with venous insufficiency.
And Crystal, real quick before we wrap up, most of these things are covered under insurance,
yes,
right?
Yes, they are. We do accept most insurance carriers. We are part of MBB Radiology, so we have a vast network of insurance carriers that we accept. We try to break down all barriers to care because at the end of the day, we're here to provide care for our patients. So we offer financing if necessary. So we do everything in our power to treat patients.
Well, thank you so much for joining us this morning. Such great information, and obviously we'd like to thank Coastal Vein Vascular Institute for sponsoring this segment. So don't forget, you can visit coastalvein.com or give them a call at 904-660-2330. I want to give that again, coastalvein.com or 904-660-2330. They offer complimentary vascular health screenings. You can come and listen to one of their seminars and just give them a call and make an appointment.